Thank you so much, Dr. Adeoshi Fogun and the organizers of this awesome conference. I feel kind of odd being a social worker in the midst of nurses, but we know that the situations that we're talking about is a multidisciplinary problem. And many of these issues, like we already know, that needs to have everybody's hands on deck. So while I might be a little odd out, but when it comes to the situation that we're dealing with, we all have, that passion, we have, that mandate of enhancing the well-being of our population, either in the medical or in the social, and we know how they impact one another. So the next slide in our study will show you the 5 constructs that our study loaded up into in terms of the different factors. So there were 5 constructs, which were financial stressors, marital relationship deficiencies, intercultural conflicts, spiritual systems, and then there were some outliers. So when we look at what is this, if we're looking at the first construct on the next slide, the factors that loaded into financial stressors was the inability for Nigerian immigrants in North America to find employment in their field of qualification. And some of us will be able to identify with this, having to change professions by reason of relocation. Then issues of American citizenship and residency status that also impacted their abilities to work and earn substantial income. Financial instability. Then, of course, the demands of sending money back home, and then the long separation prior to immigration between spouses. So those were the factors that loaded into the first construct of financial stressor. The second construct on the next slide is on marital relationship deficiencies. And what are those? It means deficiencies in marital dynamics on coping. Domestic violence was one of them, not being able to know how to handle anger and raging emotions. That was the biggest factor that led into that. And then ability to resolve marital conflicts, or actually speaking up. Okay, that cultural thing that says we don't talk about what is going on. You suffer in silence. You don't put your dirty linen out. That was another major factor that loaded into those deficiencies. And then infidelity, the issue of side chicks or side guys. In North America was one of those things that loaded into that. And then in-law issues, being able to manage that, especially in the new environment. So that was in the second construct. The third construct, as we see on the third slide, was intercultural conflicts. That is coming to North America with a mindset, that we have in Nigeria, and how that disparity affects marital disruption, causing marriages to split and, causing separation. So the disparity between the Nigerian cultural expectations and the American lifestyle, that was a major factor. Then issues of roles, male versus female role issues. Who does the cooking? Who stays at home? How can everybody be working and somebody else be expecting the other person to still be waited on? Those were major things that loaded into those intercultural conflicts. Okay. And then there was this general notion of the women embracing the American feminist ideology that conflicted with the Nigerian cultural mindsets. Okay, so that was in the third construct, and then in the fourth construct, which was spiritual systems. We do know that as Nigerians, Nigerians are very, very spiritual or have a high level of religiosity. And participants expressed that coming to North America that had a non-religious environment had its impact on being able to hold marital relationships together. Then there was also the issue of lack of personal spirituality of the couple being able to be a buffering factor in being able to handle marital disruption. And then the third factor was the materialistic American dream that sometimes become American nightmare that affected and impacted these spiritual systems in that fourth construct. Now, the two factors that came out as outliers that didn't really load into a particular construct like we had it was the issue of healthy respect. You know, there are some participants that express that as an issue. Okay, healthy respect between husband and wife, and then job pressure of being underemployed, redundancy, and all that. So those were things that participants identified in this. And as we were getting ready and looking at the discussions, we had some cultural explanations that showed up in these factors that we saw. We had the patriarchal explanation. It is documented that Nigeria is a patriarchal cultural environment where deference is given to male as opposed to female. Okay, and it's seen in issues around, you know, the girl child empowerment and women's subjugation. This is a mindset that comes with Nigerians to North America and affects some of these things when it comes to roles, when it comes to expectations, when it comes to acceptance of the environment. Okay, apart from the patriarchal environment, also, if we will move on to the next slide that is now saying that, so what do we do? What is the call to action? Where do we come in? What do we do about this? Okay, some of our recommendations on that phase of our study was the fact that we need to build into our systems Nigerian family orientation right from Nigeria when couples are coming to the US or to Canada to have proper orientation. This is what is obtaining here and all that. This is what to expect. Also, to have a supportive and empowering Nigerian community around new immigrants, okay? We recommended that. And also to have social services and medical practitioners who have working understanding of the peculiarities of the Nigerian culture. And this also to inform the kind of counsel that is being given and the level of comfort that Nigerians will have in being able to seek for these services, that they have people that would understand the Nigerian nuances, even in legal and immigration issues. Now, if you would notice, and if we are on this next slide, if you would notice that we have been moving between marital disruption and marital dissatisfaction. We started off this study with looking at marital disruption, which is separation through either physical separation or even legal separation as in a divorce. But as we carried on our study, we noticed that there could be marriages that were somewhat stable, that looked stable and did not disrupt, but were highly dissatisfying. And literature did confirm that there are people who will remain in a dissatisfactory marriage if there are barriers, or if there are factors that constrain them to remain. However, if those are not there, then it will ultimately disrupt. So we decided to shift our attention from disruption to dissatisfaction, because issues of domestic violence actually happened while the marriage was still intact, out of dissatisfaction. So we decided to look at dissatisfaction as the focus of our study. And Dr. Adeo Shifogun is going to tell us more of the next phase of this measuring marital dissatisfaction on a larger scale beyond what we have done so far. So